I call this Altoona City Council meeting to order. We'll now have a moment of silent prayer. Please stand for the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Linda, would you please call the roll?
Vice Mayor Butterbaugh,
Here.
Councilman Kashotti,
Here.
Councilman Carper,
Here.
Councilman Ickes,
Here.
Councilwoman Jordan is absent, Councilman Kelly,
Here.
Mayor Pacifico.
Here. We do have a presentation on the agenda for tonight. It was a late edition, and it's going to be a COVID update. And here joining us in council chambers, we have Chief Tim Howman, and joining us by phone, we have from UPMC, Dr. Dave Burwell and Kim Coral. So I'll hand it over to you, Chief Howman.
Thank you, Mayor. The briefing I'm going to give you tonight is similar to what you're used to getting from me every 2 weeks. Since the last time I sent you a briefing, we've had quite an uptick in cases. In fact, the most recent numbers has really shown that we've had the highest count of cases in the 24-hour period that we've had, and we're also over like the last 7 days have doubled the amount of new cases within that 7-day period. So from last week to this week, we went from 170 new cases to 326 new cases. So that's nearly double the new cases in a week's time. One of the things that we talk about whenever we go through these numbers, and I send you these every other week, but one of the things that's really kind of alarming is the incidence rate per 100,000 residents. That went up to 266.1. And the significance of that number is that's what the Department of Education and the Department of Health use for determining community spread and community transmission. So, basically that number is what we look at when we can say we definitely have community spread. The PCR testing positivity rate is another significant number that the Department of Health uses with in conjunction with the Department of Education. And right now we went from 5.6, which has us in the significant community spread, to 8%, which puts us in one of the highest categories of positivity rate in the Commonwealth. Again, these numbers are alarming because they spiked up so quickly, and they're quickly doubling almost. So, with that being said, I think it's important that we take a look at some things throughout this report that we need to take a look at to maybe help control the spread of this virus. The daily hospitalizations, and I know we have folks from UPMC on here that can probably talk more about specific things to UPMC Altoona, but according to the Department of Health, we're having about 12 hospitalizations per week, and out of those, about 2 to 4 of those are on ventilators. With the number of spike cases that we have right now, it might be a little bit different story because these numbers are a few days behind usually. The Department of Health doesn't usually get those numbers all rounded out from all the hospitals and stuff for a couple of days. So even though this report came out today, it could be very, very much higher. So the average, again, with the ventilators is about 4 patients per week that we have on ventilators. Significant about that, and I'll talk about this in a few minutes, but when you start looking at the resources the community has, and really we need to look at the COVID-19 as a local thing. Everybody likes to watch all the national news stories and see what's happening in the bigger cities and see what's happening in other places. But we really need to narrow the aperture down to what we're looking at in Altoona, and specifically Blair County, because we have a certain X number of resources to be able to handle the amount of cases that we're having. The good news is UPMC has done a very good job at getting the people from the inpatient and getting them out, getting them healthy. Some of their treatments have been very successful, and I'll let the doctor and Kim talk about that. So the only good news really out of that whole chart is that the number of emergency room cases has gone down. I think that's most likely because people are going to one of the testing centers, calling in, getting an appointment with a testing center, and then, quarantining or going back to work or whatever it is that they're going to do after their test. So we talk about Blair County numbers all the time. I want to break this down by zip code. So in Altoona, we have 854 cases. Since the last time I gave you a written report, that's roughly 402 new cases. As you'll see here down the roster here a little bit, we'll see some numbers about percentages with death rates and things like that. Right now, ours is 1.8. So to put this into perspective, in the last 3 weeks, we've had 402 cases, and based on just the sheer numbers, not talking about anything else, but just sheer numbers, we're talking about 7 people dying every 3 weeks, right here. And when you're talking about a community of 123,000 for the county, and just under 50,000 for the city, and those are significant numbers. We did go up from 33 deaths to 35 deaths. Approximately half of those can be attributed to our nursing homes. We did have some nursing home breakouts, but they got them under control quickly. And right now they're doing biweekly testing. Right now we're on the verge of going to the next level. Another 2 points on our positivity rate, and we'll have to start testing people in nursing homes weekly. And we all know what that's going to equate to. It's going to equate to more numbers, because the people who are working in nursing homes are coming and going, and they can't just stop their lives because they still have to go in and work. So we will see spikes in cases once they start testing, if that happens. So I just want to put the numbers in perspective. And one of the things I wanted to show you was, what has Penn State done here in Altoona? They had 233 of our cases that we have pop up. And again, these numbers lag behind. This is a report from Friday, and it lags behind a little bit, so there could be more numbers now. But 233 is what they're showing. The significant thing here, and what you can see, and what I kind of want to point out, how this data kind of steers us in one direction or another. You can see they did random testing, 1,100 random tests and about 1,300 on-demand testing. And from the time they started, you could see a spike in cases from when they started doing all that testing. And then as that testing went down, their number of positives, of course, went down. It's only math. But one of the things they also did was they put in strict masking procedures and enforcement of social distancing on campus, and doing as many virtual programs as they can, while still having some students do some things in the classrooms, but they went to a more virtual mix. And when they did that, you could see the cases dropped off. And at this point right now, at the amount of community spread that we have, it's going to be difficult to get a handle on it without doing something different. We did absolutely all of the stuff that we should be doing now back in April and May when we didn't have any community spread, and now we have it, and we're not doing any of it. So with those numbers, we could probably say that I'm surprised the governor hasn't already put some restrictions on based on the numbers that we have. And based on numbers that we do have right now, it would definitely put us in a yellow phase for sure. And if the numbers continue to trend, it would be even probably worse than that. So just kind of want to put that out there. I mean, I'm not sure if there's still a hangover from the elections and still trying to get all that stuff squared away, but I'm surprised we haven't done anything up to this point. As far as the John, I used like 3 to 4 different sources to get my data from, so it's not one. And just to back check the numbers, and based on this chart here, we have 1,906 cases. We had 35 deaths. The significant thing on this chart, it shows some demographics, and I'm not going to go over this whole slide with you, but the big thing here is the 90 new cases. Just overnight, we had 90 new cases, and the significant thing about this is that I talk with Mark Taylor a couple times a week. We confer, look at the data, and try to figure out what, is there something we can be doing right now? One of the things we had the Department of Health do is have epidemiologists come in and study our cases to see if there's one spot that's caused this. Is it a college? Is it the weddings? Is it whatever it might be, social events, gatherings, big events. And so far the epidemiologists cannot point to one thing. So this is truly just community spread. It has nothing to do with somebody doing a wrong thing at the wrong time somewhere. This is really just community spread. And you can look at the numbers. Huntington has a spike, and then we have a spike. Center County has a spike, then we have a spike. And a lot of that's because of the transit between the two. A lot of people in Blair County work in Center County for, Penn State's a big employer. Huntington has the prisons. That's a huge employer. So a lot of people from Blair County are traveling back and forth, and those are both hot counties like we are right now. So as long as we have that kind of people moving around like that, you're going to have higher transmission rates. Another number is that 1.84 county fatality rate. And again, this is all based on the numbers, and I just point that out because it kind of brings home, as those numbers grow, that number of death rate goes up, and I think it's significant to talk about. Again, this part of the report is more based towards UPMC, and these numbers I've got from a website called COVID Act Now, and it has the people who provide those numbers are a conglomerate of Johns Hopkins and Harvard University, and basically they're reporting from what they've found that they estimate that 42% of our ICU beds are currently filled with just normal type medical activities, and that they're estimating that we're only needing about 2 of those beds, which is only 3%. And so we don't have to really start getting worried about like having like stand-up hospitals and that sort of thing until we get into that 50% range, which we haven't ever reached anywhere close to that yet. So that's the good news of this report, is that the hospital is doing very well. And again, I can let the folks from UPMC kind of speak to that. The projected situation, obviously at this point, we're being overtaken by this virus through community spread. The spikes are basically happening because of lack of contact tracing and basically undisciplined quarantining and isolation. When the Department of Health says you need to quarantine for 2 weeks, it's 2 weeks. It's not 7 days and I get sick of it and go back into the public, and that's what we're seeing. I've had comments from some of the members of the council about some of the places that are doing testing, saying that people don't know what to do, and so that's one of the things that we need to do maybe a little bit better with our messaging, is to tell people exactly how they're supposed to handle this. Based on discussions with Mark Taylor and the Department of Health, they're projecting that we have a vaccine in December. I'm not that hopeful. There might be vaccines show up in the bigger population centers, Pittsburgh, Philadelphia, but I would highly doubt that we have it in December. I would guess probably closer to later spring, although we're hopeful that they can get it to us earlier, because as soon as we can get the vaccine, I think that these numbers will be a good bit lower. Some pertinent data for the school districts. Based on the numbers, the Department of Health and Education both use the numbers that I told you about to determine community transmission. And based on what we're seeing right now, we're over 100. We're actually more than double that 100 number for cases over a week per 100,000. We're at 267, which basically puts us in a substantial community transmission in the county, which they recommend. This is just a recommendation, but they recommend the full remote learning model. And I briefed the school board last week on this and went over this chart. And that's kind of what they were looking at as far as why they went to the AB model and not bringing all the kids back at one time. Based on the numbers being doubled since I even briefed them last week, I'm not sure if they're going to look at doing anything different. But at this point, the recommendations from this chart in Department of Health and Department of Education says we should be looking towards figuring out how to get to a full remote model. Based on the White House Corona Task Force and Harvard Global Health Institute's recommendations, they have our numbers, and they made recommendations for every county basically in the country. And based on Blair County's numbers, the cases per 100,000 in the last 7 days and a positive test rate of 5.5, it's actually 8 now, so this is a little bit old. This recommendation is that gyms should be at 25% capacity, masks should be worn everywhere, should be mandatory in all public places. Restaurants should, basically all the things that we did in the spring, we should be doing again. Bars should be avoided and required to close. Schools should be, handling this through remote learning. And then gatherings should be limited to 25 people. So these are the recommendations based on what the White House Corona Task Force and the Harvard Global Health Institute are recommending to stop the community transmission. So, those are just some recommended actions that are out there based on our numbers, and our numbers are only going up. So that's, those recommendations are only going to get stricter, and that's why I said this is more of a yellow phase type restriction, where I think the numbers where we're heading, unless we do something different real fast, where we're heading is, back to a red type phase. So with that being said, we already went over the casualties. Since the last report, we've lost 12 more residents to COVID-19. And again, those numbers are generally people that are older and have some type of risk factor. But we have had some kids that have come up positive. The schools and the children are carrying this much easier and transmitting it to the teachers and folks in the schools. And they're taking it home to their families. But it's not just those people, it's everywhere. Our fire department, we've been very careful in how we handle being in the public and doing what we have to do. And we have a couple of cases. We had one that was quarantined, isolated. He was positive. He just came back to work today after his quarantine was up, and I just had another one yesterday that had to be quarantined, plus three people that he worked with, we had to quarantine also. So right now we have one on isolation and 2 on quarantine. So it's going to start to affect the resources, not just the hospital resources, but resources we have here to protect the public. As far as the planned activities, there's really not a whole lot new there compared to the last briefings that you've got. I did add a couple of things that are important, and that's basically, probably reviewing community events on a case-by-case basis, which we've been doing. And I think that some of those recommendations are out there about some of the events that we have planned coming up in the future. And, I think it was important to have everybody have these numbers and know what the trends are, and kind of have an idea that, we're trending towards where we could be, putting our resources as far as public safety at risk if we don't do some things different. And with that, I'd like to ask Dr. Burwell or Kim, if you're there, go ahead and make any comments you have. And I certainly appreciate you guys taking the time to come here today. I know you guys are really, really busy, and I certainly appreciate the time you're taking to give us the information that we need to make some right decisions.
Yes, sir. Mr. Mayor and members of City Council, I appreciate the opportunity to talk with you all tonight. First of all, I could not agree more with Mr. Heilman's assessment. The only thing that is not concurrent is the rate of hospitalizations as reported on the website from Department of Health. Either is lagging behind or just is not matching our rate in the region. And when I say region, I say Altoona, Bedford, Somerset, and Western Maryland. We have over 100 patients hospitalized currently, and about 20 to 25% of those are in the ICU on ventilators. So I have to say that the number reported this evening is quite low versus what that is. So I don't mean to be alarmist, but I want to reflect what's actually occurring. But to that point, we have not seen the prevalence of the virus in our community here as significant as it is today. So I agree. What we're seeing in our contact tracings are exactly what Mr. Heilman's stating, is that it is community spread, and it is significant. And we do believe that the mitigation strategies of wearing a mask, watching your distance, and washing your hands, and staying at home from work are more important even today, especially for our community, than they were earlier on in the pandemic. But so that's the state of affairs from our region. I know that Kim Coral can talk to you about what we've been doing in the hospital to increase our capacity management and some of the steps that we're taking to make sure that we can care for the community at the highest quality that we can provide. Kim, are you on?
Do you have any questions?
Yeah.
Oh, Kim.
Is she on the call with us?
She was.
Oh, I'm sorry, if she's not on the line, go ahead and you can ask your question.
She was muted. She keeps muting. I unmuted her. Muted back. Go ahead.
Kim, are you with us? You can make any comments that you have.
Doctor, let me fill the empty silence here. This is Bruce Kelly,
Go ahead.
member of council. February 12th of this year, UPMC announced that they were closing the ICU at UPMC Bedford. Is that still the case, or did they reopen the ICU in Bedford?
So that is still the case at this time. The managing cases in Bedford is something that we continue to look at to see what in capacity, because we're working within the region in order to make sure that we can manage patients effectively. So the ICU at Bedford is remaining closed, but that doesn't mean that we don't utilize those beds in other capacity. I do believe that Kim Kroll is on the line. Kim, are you able to speak now? She sent me a message that they need to let me speak. Is that something that you have to let her into the meeting?
So, Doctor, I'll just push on with that as a follow-up onto that. So those patients that will be going to UPMC Bedford, should it be deemed that they need a higher level of care, where are they being transferred to?
So it depends on what they require. So a fair amount of patients that would require a higher level of care would either come to the ICU at UPMC Altoona or UPMC Somerset, or depending on what they need in particular, they may go to UPMC Presbyterian.
Okay.
Dr. Burwell, this is Mayor Pacifica. I have a question for you. In about a month from now, we have our Christmas parade scheduled. You would recommend that we cancel that parade? Is that what I'm getting from what the report tonight that you gave and what Chief Howman gave, is that would not be a good idea for us to hold moving forward?
I think that's a decision that you all will have to make, given the information. It's a significant amount of community spread. I do believe that certain things can be done safely if there's appropriate high rates of masking, physical distancing, and the like. So if and you'll have to follow the Department of Health's guidance as well on that. If you believe that our community is capable of doing that within the reins of an event, then so be it. But if not, really we would just really accentuate the spread and potentially harm our community, which would be the exact opposite of the desire of such an event. So. That's a decision of your group, and I'm sure a difficult one.
Dr. Burwell, this is Councilman Jesse Ickes. I know that you and I had some email correspondence over the last couple of weeks. Are patients that are coming in for elective or non-elective surgeries being required to take a COVID test prior to the surgery?
So it is. We've never made a requirement. We've offered patients to have a COVID test prior to, and that is we've changed the offering depending on the potential high rate of transmission, depending on the procedure, as far as whether or not it's offered, and it's up to the surgeon to determine whether or not that is to be offered. So it's not mandatory, but certain surgeons have done that in the past. We are not changing any level of PPE based upon whether somebody has, or any of our procedures based upon whether or not the patient has a COVID test or not. We've done a significant amount of asymptomatic testing, and it's really, it's around 0.2% or some, it's a very low percentage of patients that we did capture with doing testing for that. We really did not make it mandatory because it was very low yield. But people are continuing to offer that if they'd like, but it doesn't change doesn't change what our staff and our surgeons wear or how we do the procedure, because we use the highest level of PPE. So that portion doesn't really matter whether or not they get tested beforehand or not. But we have, certain surgeons have offered that.
Doctor, a follow-up on that, is there any discussion from UPMC with regard to the immediate future for elective surgical procedures? Because in the spring, that stopped, I believe, in April, but of course, postponing a lot of those surgeries creates other problems, plus it certainly creates a revenue problem for hospitals.
Yeah, here's the thing. So elective surgeries, we really, during the pandemic, we don't like to characterize surgeries as elective or non-elective, because elective surgeries are just scheduled, right? But some of them are extremely essential, whether it be cancer-related care or other care that cannot be delayed. And any delay could cause significant harm. So we really take that seriously, any sort of delay in providing adequate care. I think your concern is, are we looking at potentially, was your question whether or not we're looking at reducing elective surgeries at this time? Was that the question?
Yes, that's correct.
Yeah, so at this time, we will monitor this. If we do get to a certain capacity of COVID patients in our hospital and resource capacities, we will have to monitor to see which patients, or if we need to adjust those schedules. But we do not plan on reducing providing essential procedures by any means. So we have not done that since the directive from the governor, and we don't plan to reduce essential procedures in the future.
Certainly the stock market was giddy today with a 2-page news release from Pfizer about their vaccine, and it's really the only game in town now to talk about. But I mean, I see some. I just worry that people may look at that and think that we have a silver bullet now, and throw caution to the wind. I mean, I think there's a lot that has to be worked out with this. I know Tim alluded to this early, and that's the whole point of supply side logistics as to how this is going to be distributed. Also, this is a memory RNA vaccine, which is some of the newer vaccines that they're working on. But this is a 2-dose vaccine that has to be administered 3 weeks apart, which I think as a provider would probably make you concerned with, patient compliance and people coming back for the second dose. The other thing I noticed about the vaccine is I'm wondering whether or not there'll be a pediatric indication for this, because when it was first started studying, they were only looking at patients over the age of 18. They did do an inclusion of patients down as young as 16, though, in September. But I mean, I look at that, and again, I'm a layperson, but I'm thinking there may not be a pediatric indication for this vaccine when it does pass muster before the FDA. I mean, just any general thoughts that you would have or cautions that you would want to offer to those that are listening to this meeting tonight.
Right. I think it's a very good point and a very valid point. You know, in the medical community, we see the vaccine and these later stages results, and I believe over the next few weeks we're going to hear more from probably a couple different companies discussing, and then FDA looking at emergency use criteria for these. So we're excited about it, but like you mentioned, we cannot throw caution to the wind. It is not here. We don't have a vaccine in our hand. Also, immediately after you receive the vaccine does not mean that you are, totally shielded from the infection. There's a period of time that you have to develop antibodies and the like. So yes, it's exciting as we all want to make sure that we follow the mitigation strategies with the idea that this is a bridge to go back to the way our society was. And I think that's really exciting, especially psychologically. But it's not here right now. But what is here right now is a large prevalence of the virus and in our community that we have not seen at this time in the pandemic. So no, this is no time to be lax with our mitigation strategies at all. But it is exciting to see the hope for as 2021 rolls around. We're hoping to see vulnerable populations covered, healthcare workers covered, and slowly move throughout the remainder of the population.
So, Dr. Burwell, this is Councilman Matt Kishotti. I just have a quick question. Come on. This could either be to you or to Chief Howman. I wanted to take a step back, and because we hear the word a lot, the term a lot, community spread, but I was really taken aback a minute ago when we heard that there are still people that are testing positive and don't really know how to quarantine or what to do, because it seems like it's all common knowledge at this point. If we just tell people to wear their masks and to follow CDC and to social distance, you feel like you're just repeating yourself over and over, and everybody kind of understands what's going on and what to do. So, we're now in a community spread, but I guess what I'm asking for is, for the people watching tonight, can we really drive home what the term community spread means? What's the validity and the seriousness of that term? Because it's something that we're hearing, and we might be sort of, just ramping over it because we've gotten ourselves to a place where we're kind of glazing over it, some information, because we have fatigue from hearing it all the time. So I hate to put either one of you on the spot, but could you maybe just define what community spread means? What is the seriousness of that? What's the validity of a community spread?
Dr. Brule, I can answer that, or do you want to take that?
I can take it just briefly, and you can add in. I mean, the real thing is, so earlier on you see pockets and clusters, right? You can see how it moves throughout in certain regions versus the dispersion of it within the community. What we're really telling people is that it's so prevalent throughout the community that you can't just avoid certain pockets. It really is that you need to make sure that you're masking outside of your household and public and things such as this, and taking the mitigation strategy seriously, that you're really not, you can really just be lax with your own household, within your household. That's what it means. It's basically, when you're out in the community, it could be spread throughout multiple ways. But you're really okay to stay within your own household, because those are the people that you're with, and that's what you're with. But the challenge, it's not the clusters. I think that's what you're trying to drive home, and what we're trying to drive home, that is when you're not with people of your own household, you need to be masked.
And Councilman, I would just add to that.
Mr. Howland?
Yeah, I would just like to add to that when you talk about community spread, it means that any congregate place is unsafe. Any place that you're going to go where you have multiple people that are unmasked it's unsafe. So what do? We have to look at those places that are congregate areas that we're still using right now, and not necessarily having the greatest discipline in masking and keeping social distances. And you can take a look at those places right now. You know, some of the places that we're having the cases come from are, you know, schools, churches, any place else where there's gatherings. You know, the football games and all the stuff that we've been doing at this point, you know, we thought was safe, and now when there's community spread, those places where there's, you know, those areas where people congregate is where you're going to get the spread from. And there's really no way of stopping that unless we're very disciplined with masking and social distancing. And you know, to be honest with ourselves, we're not quite seeing that in our community right now. And I don't know how to hammer the information any harder, but you know, this is real and it's not going to go away, and it's only going to get worse unless we start to get smart about our choices, especially when it comes to what we do in the public and you know, even around our own families, and it's tough.
Have we been able to connect with Kim Coral?
Can you hear me?
Yes,
There
we
we
can hear
go.
you.
Okay. Yeah, so as far as the hospital, you know, we started our emergency operations plan early in February at the start of this pandemic, and we have multiple phases of it that we enact depending on the number of patients that we have. So we do have a lot of backup plans so that we can use other non-traditional areas within the hospital to bed patients and make sure that we have the needed supplies and space for the patients that are coming, whether that be our typical patient population or the COVID patient population. And I'm happy to answer any other questions you might have about that Dr. Burwell hasn't already covered.
I don't know if this pertains directly to that topic, but I guess I'd like to talk about the strain that's probably been placed on the healthcare workers. I mean, obviously we're 7 to 8 months into the pandemic here, and including Blair County. So how is the UPMC network working with its doctors and nurses to ensure that our community, obviously, you know, in a situation where we have an increasing number of cases, that those folks are getting care, but also how's UPMC handling the situation and making sure they're taking care of their own from a doctor or nursing standpoint?
Yeah, I think, you know, that's one of the benefits of being part of a larger system, that we do have that support and resources to help us through that. You know, this is like nothing else that we've seen in healthcare, and it definitely is challenging, but you know, our staff have done a great job and really risen to the occasion. And we've looked at all kinds of, you know, methods of alternate staffing and making sure that we use, you know, maybe non-direct clinical staff in any way possible, certainly providing self-care information and support to the staff. But, you know, overall, I think the employees have done a fantastic job, and I don't know, Dr. Burwell, if you want to add anything.
I just want to echo that our staff are extremely resilient, but I also want to acknowledge that the care of COVID patients can be very, very straining, very challenging. Some patients may be in the ICU for 60 days, 90 days on ventilators, requiring substantial support. Our nursing staff are they're working extremely hard. They're putting in long hours. They are really rising to the challenge. They are truly healthcare heroes. So I really want to say that we have the most phenomenal staff, and they've risen to this challenge that they hadn't faced before. And just want to let you know that they're handling it and doing a wonderful job, but it's not without strain, not without challenge.
I'll bring up a topic I had discussed with Chief Heilman, and that was the availability of testing. And so right now, unless I'm in a long-term care facility, then my testing choices in the Altoona area are to have an order from my provider and go to the facility that UPMC has on Pleasant Valley Boulevard, or go to the local urgent care. And I know from having made a visit to the local urgent care, they're slammed. I mean, they were double parked in their parking lot. They were parked in two adjoining businesses' parking lots. There was discussion in the springtime that the State Department of Health was going to look to add a separate testing facility in Blair County. That didn't materialize. What has to happen before the Department of Health steps in and wants to put an additional testing facility here in Altoona, Blair County?
Dr. Brewer or Kim, do you have any ideas about basically what the criteria is for standing up a testing site?
I'm sorry, I don't know what the Department of Health's criteria is for doing that. I know that in some neighboring counties, Dr. Levine has issued those based upon certain incident rates, but I've not seen that consistent across the board. So I really can't speak to that. I can speak about our specific site, and in the method, it was exactly as it was addressed just a second ago. But I do not know how Dr. Levine and Department of Health their criteria for standing up additional sites are.
I have talked to the county.
Yeah, and this is Kim.
Okay, Kim.
I'm not aware of any specific criteria either regarding that. I haven't heard.
I know I've worked with the county on this topic, and the response basically from the Department of Health right now is we're not there yet. That could be changed on a daily basis, I'd imagine. And since they're looking at the adjoining counties that have numbers spiked as high as ours, I would imagine that we would be in that look here very soon.
Well, one of the problems is if people present themselves at Med Express, which is the urgent care I was referencing, I mean, they're slammed. They have ability to only handle so many per day. One of the things that they're experiencing is employers that have a patient, or someone tests positive in a workplace, and then employers want to send 20 people over who may have had contact with that individual, and they're not able to handle everybody.
And that's the biggest problem we have right now is knowing that what the CDC guidelines are, and people not wanting to have folks off of work for 2 weeks, coming up with their own alternative plan of getting a test, and seeing if that's good. But the truth of the matter is you can't test your way out of this issue, because the incubation period up to 5 days, and correct me, doctor, if I'm wrong, but with an incubation period up to 5 days, you could not have it on a test positive Tuesday, and Wednesday, the incubation period, you develop the symptoms. So, really the guidelines need to be looked at and followed as far as what sector you're in. There's different guidelines for the different sectors, but I mean, from schools to public safety to businesses. So you need to find the one that you match up with and use those guidelines, because it really is put into place to protect the testing that we have available. And I don't see this changing as far as the number of tests unless something big happens in the next couple of months. I don't see this changing. So I think people need to, take a look. Go ahead, doctor.
Oh, I completely agree with you. That some of the challenges that we've seen is, there's, like you said, exposure, and then everybody wants to be tested. If you're asymptomatic and you've been exposed, you're quarantined for 14 days. So the going to get a test, really all that gives you is maybe a false sense of hope. If you're negative, so what? You're still quarantined for 14 days, which is a challenge. I mean, it's really a challenge financially. I understand that, and a strain on the businesses, but that is the current guidelines. And adhering to those guidelines are really substantial. So we highly recommend that. Now, if somebody is exposed and then develops symptoms, they should be tested at that point. I know that, like you said, the incubation period is as early as 5 days, could be 7, 10 days. So that it can be very limited. Also, some of the rapid testing is not as accurate as it could be. We employ the PCR testing, which has a 99% accuracy level, but it does take. Our average turnaround times are 72 hours, so that can be substantial.
Well,
So,
what's your, I mean, it's, the use of the phrase false sense of security. I mean, I understand what you're saying, but of course, if people don't know they have the virus, then it's a little tough to tell people that you may have come into contact with that they may need that they may have been exposed to it or have to self-quarantine. What is UPMC here in Altoona at your facility on Pleasant Valley? What's your capacity to handle per day?
So we usually have we have up until and I know I'm going to say the number and it's probably higher than that. We've had up to 70 or 70 plus. The vast majority, I have to tell you, we are getting in people within 24 to 48 hours pretty rapidly to get those testing done. So we don't have a significant backlog to get into test.
And once someone is administered the test, what's your turnaround time with the lab to have results on that test?
Yeah, so that's 72 hours
Okay.
After you get the test. And if you are tested because you're symptomatic, you should be quarantining during that time period. If you are if that's the reason why you had the test is because you're symptomatic, then if you are negative for the test, then you can discontinue the quarantine. If you're exposed and you're asymptomatic, that's a 14-day quarantine. I have to tell you, and we talked about numbers earlier, our symptomatic positivity rate at our collection site for the last 7 days was a little bit above 25%. So 1 in 4 people that we sent over that had symptoms tested positive. That's for October it was around 16%, and September is around 3%. So it's gone up significantly in the past weeks.
Just from memory, several of the articles that I've read regarding the increase in cases probably over the last 2 weeks do have some kind of indication from Dr. Levine and the Wolf administration that the Commonwealth appears to be in a much better situation than what it was in March. Are you able to talk a little bit about the better position that UPMC Altoona may be in compared to the March situation to handle the increase in cases we're seeing?
And I think Kim may be able to speak to that as well, but the emergency planning that we underwent in the spring, we have kept into place this entire time. So you can go ahead and talk to that, Kim.
Sure. As Dr. Burwell said, we did planning early because we anticipated what could happen. And, we didn't see that in the spring, even into the summer, but we are definitely seeing it now. So we have in our plans areas within the hospital that we can use that are the non-traditional inpatient units. And that is part of our plan to accommodate additional patients or additional COVID patients. We've also inventoried our supplies early on and have backup supplies if needed for additional patients. So we feel that we're in an adequate position. And again, that's where it's really beneficial to be part of the larger UPMC system because we do work as a whole. So that can help provide our local UPMC Altoona support as well. So we feel that we are definitely in a good position, but again, echoing, it is challenging because, this is a pandemic and it's definitely something that we've not seen before, but we do feel we've prepared well for it and are executing a lot of those plans as we see increases in our numbers.
So I'd just like to touch on that briefly. Our care providers, our frontline staff now are better at diagnosing and treating the illnesses associated with COVID-19 much better. And the data that's coming out, we're using treatments that are more effective than before were more experimental. The use of things such as steroids, the use of remdesivir, and these types of treatments are definitely making a substantial difference. And I think it's bearing out. As you can see, the mortality rates have decreased. Now, the challenge is the mortality rates do lag behind the hospitalizations. So that is yet to be seen for this increase in growth in cases. But I do have to say that our clinical staff are much more comfortable with noticing the care changes and transitions in a patient that has COVID-19. I do believe because of that, we're seeing better outcomes.
Does anybody else have anything for?
I had one quick question to reiterate, Chief Hellman. You were saying about the ICU beds in Blair, and I know you had a percentage in your presentation. What does that come out to on flat numbers? How many ICU beds do we have?
Yeah,
and how many are
so
full
the
right
numbers,
now?
it's like a moving target. One site says we have 137 beds, and another one says we have 50 some beds. So I'll be honest with you, it's somewhere between those two numbers. And you're looking at roughly 58 of those beds being used, and only 3% of that being used for COVID-19. That's what the numbers are that's being reported by the Department of Health and through these other sites that are tracking this data. The folks from the hospital might be able to maybe zero that in a little bit better.
Yeah.
But the count is, it says in Blair County we have 137 ICU beds.
Okay, so we're a little bit less than half that are full right now.
Right. And basically,
I have to say, don't those numbers, just word of caution that those are not what we're seeing internally. Those are I don't know when those numbers are from, but Kim's on the line as well. I can't give you specifics, but the numbers that's reported are significantly lower than what we're seeing today.
Well, I'm sorry, I missed that. It's lower?
Your microphone's off.
I'm sorry, I missed that last part. You said they're low. The numbers are significantly lower, you said?
The numbers that were just reported are significantly lower than what we're seeing. So we are seeing in our region, so out of those 4 hospitals, we have over 100 patients hospitalized with COVID-19. Over 25% of them are in our ICU on ventilators. So I don't know when those numbers will adequately reflect what we're seeing, and when they'll change, but I do have to tell you that we have more cases, a fair amount more cases than what is showing on the website in our hospital today.
So that's only leaving so that's about a third of the ICU beds that are full right now as we speak. I'm sorry, about 3/4. About 3/4 of the ICU beds that we have
Well,
are full.
their network is Somerset and Bedford as well. So
And they could be
Not
used for other
Bedford,
procedures.
There's no ICU beds in Bedford.
Right.
It's
Closed.
They're
It's
coming up
Cumberland
from
and
Bedford.
Somerset
Yeah.
is what they have.
So, the Department of Health was reporting that we had 14, I think we had somewhere around 40, 47, 48 inpatients with 14 on ventilators in the county. But again, that number's lagging behind. So, and they look at it over a period of time too when they report that. So each one of those reporting websites gives a different time frame. I think it better to look at, the trend, which the trend is, October 16th, we had 2 people on on ventilators, and just 3 short weeks later, we have upwards of 25 to 14 to 25. So I mean that's a significant trend upwards. Is that fair in saying, Dr. Burwell?
That's absolutely the case.
Yeah, that's not promising.
Just one thing I'd like to add before we close out. I'd just like to add that we did plan for I appreciate the supply question you had for UPMC. Here in the city, what we did was at the very beginning of this, we took inventory of what we had. We used some modeling to figure out what we would need to get through 3 different waves of this, because that's what everybody was predicting back when it started. And we're kind of holding to that. Our first wave, we basically had nothing, so we didn't use up hardly any of the stock for our first wave. This second wave, we're starting to use a lot faster. The third wave of our materials are coming in through a federal grant, which would give us enough for a third wave and then into the next year. We have not seen that come to fruition yet. It was part of a huge regional grant, and we're hoping that those come in the next few weeks. We're good on supplies to cover us, but I just want to give you that long-term look of what we did for procuring our materials.
When you say supplies and material, is that mostly PPE?
It's PPE, cleaning supplies, stuff that we need to use every day, disposable masks, all those things to be able to keep our workforce safe, and then those that are in public safety, of course, protect themselves and the public from any further spread of the virus. It's not 100%, but we've done pretty well as far as the public safety folks. Like the police have done an awesome job. When you see them out in the field, they're always masked up. They're always doing the right thing when it comes to protecting themselves and social distancing, which in that line of work is very difficult. So they should be commended in what they're doing. Our guys, of course, I think the cases that we've had have come from outside and did not happen during work time, but it's impossible not to bring some of these things to work. It's next to impossible. So, but I think everybody's doing a good job, and I think we'll get through this. Our 300-meter target, I guess, to look at is this vaccine. When we can get to that vaccine, it's going to be a game changer. But we really have to do what's right now until we can get to that game-changing addition to what we have in our playbook for this.
So the last thing to take from this, as they say, if you remember nothing else from this presentation, is what? To do what you've been doing back in March and April. If you sort of got out of the habits of whatever it was you were doing that was above and beyond the CDC recommendations back in March and April, you should really kind of revisit those actions for yourself and your family and your coworkers, because really in March and April we were not in a surge, but now we are. So the national attention that we were seeing for New York City and for California and everything else, it really didn't matter much here. So now's the time we need to be doing whatever we were doing in March and April. Am I correct?
Yeah, absolutely. And I think what we need to do now is, you've gotten some of the raw data, and this stuff is real time. This isn't like, we didn't have time really to kind of war game this and staff this as far as, a solid recommendation. But I would say at this point, based on what we know as far as the guidelines from the White House Task Force and, some of the folks at Harvard and Johns Hopkins, that, we should be looking at that yellow phase. So everything that was in that report, and I have a hard copy of that report to give to you after this briefing, all those things that are recommended, I think we should be pushing and recommending in social media and every other outlet that we can possibly do in our meetings with all the different committees and things that everybody's on. We should be really saying that this is what we need to do. And anywhere that we can do things virtually, I think we should be doing it. I think we should be setting an example for the rest of the community in just about everything that we do. And I think that would be the best recommendation at this point, because I think the legal challenges of mandates and all that kind of stuff, I mean, you get into all kinds of issues with that legally and politically. So I just, at this point, I think we need to make recommendations, inform the people of our city, and I think with the right information and armed with the data that we've given you tonight, they can make some right decisions about where they're going to go and when they're going to wear a mask.
I agree with that. Is there a place that our community, they can go for local information? Is it, I know it's something we.
Yeah, the police have a highly trafficked site on Facebook. We have the Altoona Emergency Management site, and I think this Codes has a site now too. I think we can share some stuff on that. So, so we have a number of social media sites that we can put that out with. We can use the Access channel, and I think that that's the extent of what we have in our playbook right now. But looking at this from the standpoint of what we had in the spring and what we have now, I would not be surprised if there's a state mandate at some point to move backwards as far as restrictions go. Any other questions? I'd just like to again thank Kim and Dr. Burwell for coming and supporting and backing me up as far as all this stuff. It's nice to have some experts from the community backing you up. So, and UPMC is doing a great job right now, and we're lucky to have them as a community partner in fighting this pandemic. So, just like to thank them again.
Thank you.
Thank you.
Thank you, and thank you all, and anytime. Thank you very much.
All right, thank you for being here tonight.
Yep. Thanks, Doctor. Thanks, Kim. Thanks, Chief.
Okay, at this time we'll move on to public comment. If anybody would like to address council, please call the number that will be displayed up on the screen. We ask that you please keep your comments to under 5 minutes, and when your turn to speak, please give your name and address for the record. Okay, seeing no public comment, we will close the floor and move on to the resolutions.
Item A, approving the minutes of the Altoona City Council meeting held Wednesday, October 14th, 2020. Item B, amending the 2019 CDBG COVID-19 Round 1, removing and transferring $237,840 from the Margaret Avenue Emergency Distribution Center project to the newly created Family Services Homeless Shelter Rehabilitation Project. Item C is amending the 2019 Community Development Block Grant Program COVID-19 Round 3 funds, awarding $305,145 to the Family Services Homeless Shelter Rehabilitation Project, and further authorizing the mayor to execute all documents. Item D is authorizing the city manager and finance director to execute the termination of the agreement with Mass Mutual and to install ICMA RC as the entity providing administrative services relative to the city's retirement savings 457 plan, and for the city clerk to attest to same. Item E is a repository bid in the amount of $590 submitted by, this would be approving a repository bid in the amount of $590 submitted by Dior Lowry of Pottstown. These are all from Dior Lowry of Pottstown.
Hey, Linda?
Yes.
I think the plan is to table these again until we have the agreement in place for repository bids. So
Okay.
if you want to just forego having to read those, you
All
can
right.
do that.
So, are there any additions or deletions or items that need to be pulled for separate vote? Other than we will be tabling those again.
Items B and C.
B and C. And that's a conflict.
Yeah.
Okay, I have something you can sign it
Okay.
after the meeting to attach to the resolution.
Thank you.
And I have a question for Tom. Do I have to recuse myself from letter D? I participate in the 457 plan.
So do I.
I really, I don't,
You don't vote for it.
Mayor, I don't see, I don't see an issue with that. But if
Okay.
you feel more comfortable abstaining, you can. I mean,
All right.
but, yeah. Because it's not, it's just hiring the, changing the manager, that's all.
All right. If you say that's okay.
Yeah,
then that's fine.
I'm okay with it.
All right.
Okay, let's see here. We're gonna take the consent vote on items A, D, A and D first. Vice Mayor Butterball,
Yes.
Councilman Kashadi,
Yes.
Councilman Carper,
Yes.
Councilman Ickes,
Yes.
Councilwoman Jordan is absent, Councilman Kelly,
Yes.
Mayor Pacifico.
Yes.
The consent vote passes 6-0. And then we have a separate vote on item B, which is amending the 2019 CDBG COVID Round 1, removing and transferring $237,840 from the Margaret Avenue Emergency Distribution Project to the newly created Family Services Homeless Shelter Rehabilitation Project. Vice Mayor Butterball,
Yes.
Councilman Kashadi,
Yes.
Councilman Carper,
Yes.
Councilman Ickes is
Abstain.
abstaining. Councilwoman Jordan is absent. Councilman Kelly
Yes.
and Mayor Pacifico.
Yes.
And the vote passes 5-0. And we have item C, which is amending the 2019 CDBG program Round 3 funds, awarding $305,145 to the Family Services Homeless Shelter Rehabilitation Project, and further authorizing the mayor to execute all documents. This is C. Vice Mayor Butterball,
Yes.
Councilman Kashadi,
Yes.
Councilman Carper,
Yes.
Councilman Ickes,
Abstain.
Councilwoman Jordan is absent. Councilman Kelly,
Yes.
Mayor Pacifico.
Yes.
The vote passes 5-0.
I thought about that, yeah.
And we have ordinance number 1 for introduction. It's an ordinance of the City of Altoona and the County of Blair, Commonwealth of Pennsylvania, appropriating specific sums estimated to be required for the specific purposes of the municipal government hereinafter set forth during the year 2021. And this ordinance is known as the 2021 budget ordinance.
Would you guys be okay of introducing this as a governing body?
Sure.
Yeah, I'm good with that.
Because everybody really, staff and all people involved really did a good job putting this together.
This ordinance was introduced by the governing body. The second ordinance is an ordinance of the City of Altoona incurring lease rental debt as defined in the Pennsylvania Local Government Unit Debt Act in a principal amount not to exceed $7,500,000, evidenced by its guarantee of 100% of the payments due under a debt obligation of the Altoona Water Authority issued to the Pennsylvania Infrastructure Investment Authority in connection with the water system operated by the authority, and pay related expenses, authorizing a guarantee agreement by and among the city as guarantor, the authority, and Penvest as lender, securing the debt obligation pledging, 1, certain water system lease revenues of the city, 2, the full faith credit and taxing power of the city in support of its guarantee, appointing a sinking fund depository in connection with such guarantee, and authorizing related actions and documents. Is there a council member willing to introduce this ordinance?
So moved.
This ordinance was introduced by Vice Mayor Butterbaugh. We have a third ordinance for introduction. It's an ordinance of the City of Altoona incurring lease rental debt as defined in the Pennsylvania Local Government Unit Debt Act in a principal amount not to exceed $36,615,700, estimated by its guarantee of 100% of the payments due under a debt obligation of 100% of the Altoona Water Authority issued to the Pennsylvania Infrastructure Investment Authority in connection with the sewer system operated by the authority, and pay related expenses, authorizing a guarantee agreement by and among the city as guarantor, the authority, and Penvest as lender, securing the debt obligation, pledging, 1, certain sewer system lease revenues of the city, 2, the full faith credit and taxing power of the city in support of its guarantee, appointing a sinking fund depository in connection with such guarantee, and authorizing related actions and documents. Is there a council member willing to introduce this ordinance?
So moved.
Is that Councilman Kashadi? Councilman Ickes? Okay,
I can
thank
have
you.
it if you'd like.
This ordinance was introduced by Councilman Ickes. And we have ordinance number 4, which is scheduled for adoption. It was introduced by Councilman Kelly. It's an ordinance of the City of Altoona amending the code of the City of Altoona by adding a new Chapter 557 to be entitled Purchasing of Real Estate Materials, Supplies, and Services, to provide definitions, provide procedures and parameters for purchasing real estate, materials, supplies, and services, provide for establishment of a Director of Purchasing and corresponding powers and duties, provide bidding requirements and procedures, provide parameters for requests for proposals, provide process for, provide severability of provisions, repealer, and provide an effective date. Is there a motion for adoption?
So moved.
A second?
Second.
This ordinance was moved for adoption by Councilman Kashadi, seconded by Vice Mayor Butterbaugh, and I'll call the roll for a vote. Vice Mayor Butterbaugh?
Yes.
Councilman Kashadi?
Yes.
Councilman Carper?
Yes.
Councilman Ickes?
Yes.
Councilwoman Jordan is absent. Councilman Kelly?
Yes.
Mayor Pacifico?
Yes.
And the vote passes 6-0.
Okay, we'll move on to city manager updates. Ken?
Mayor, Council, first, Wednesday is Veterans Day, so I want to tip my hat to my fellow veterans and thank them for their service. On that note, there is a testing location in Altoona, the VA hospital, that Chief Heilman speaks very highly of, that gets very quick results. So if you show up with your DD-214 and get entered into the system, that's an avenue for people who have served. So just another resource out there for as a testing site. On the subject of COVID-19, we received some communication from Steve McKnight at ABCD, Pat Miller, and UPMC regarding the Christmas parade. And it would seem their medical advice, maybe not to overstate it too much, but is that they did not seem enthusiastic about the prospects of the parade. I believe the Veterans parade went off without a hitch, but I guess it falls to the council to decide what to do about the Christmas parade.
Has that historically been a council decision?
Well,
But I think it's always been in conjunction with the city of Altoona sort of thing. So yeah, it's technically not our parade, so to speak, but I guess it is in the sense that we do have some say in it because we do kind of help out with it a little bit. But I mean, as far as putting it on goes, we don't have any involvement, in that aspect of it whatsoever, or really organizing it on the larger scale, much aside from our involvement that Linda and I have. And Chief Howman was involved this year as well because of COVID protocols and the police department too.
Yeah,
But
traffic control, public
Yeah.
works doing some setup. I think the department heads who were involved weighed in, but you certainly could defer that decision to GADEC and ABCD if you are so inclined. I just didn't want to let the issue pass without at least soliciting some kind of council guidance. Or if there's not.
Well, the difference between the Veterans Parade and the Christmas Parade, the Veterans Parade, everybody was well spread out along the route, and even during the ceremony, there was perhaps a little less attendance than in years past, but we almost all of us had masks on, and it was perfect sunny weather for it. So we had
and
that
has
going.
that has a longer route too that starts
Yes.
over on the other side of the bridge. So you are able to, and we did see that on Saturday. We did see most of the crowd was spaced out pretty well. You can't guarantee that at the Christmas parade because
Yeah, the
that
Christmas parade
usually draws in
yeah.
5,000 people.
very close knit, much more dense in the attendance because everybody's like boom right there at Heritage Plaza or within a few blocks of there. And
Weren't we initially planning to have the Christmas parade but not disseminate candy? I mean, did we feel that would reduce attendance?
I don't think the point of that was to reduce attendance. I think it was to reduce people touching things and giving them to other people to touch. I think that was the gist of that. But
nobody wants to make the decision, but I'll tell you what. I mean, I know enough people in the medical field. I'm not putting them in any more. They already got enough problems. They already got enough to deal with. I have no problem with. I have no problem with us making the decision to sort of hold off on it. I think based on the advice we've been getting. Everybody sort of says, hey, you shouldn't have it. We just don't want to be the ones to be responsible for making this decision to not have it. I have no problem with going along with not having it. Just because everybody's real close together downtown and with the situation of our numbers spiking and I give a lot of respect to Chief Howman and all the work he's done and our first responders and the folks at UPMC and yeah, so that's pretty much my opinion on it, as unpopular as it may be, perhaps.
no, I agree with you. I think
Do we have to have a formal vote on this?
no.
Okay.
I go back, Ken summarized it beautifully. It's not our parade. All we are, the city, is the permitting agent. But I would caution my fellow council members that if you are going to not allow the Christmas parade, then what are you going to do when other people want to come and make application for either a parade or a public gathering downtown? So I just think you need to be thinking these things through to the next step.
Yeah, I'm not thinking
Okay.
in terms of allow or not allow, actually. If the decision's going to lie on us, it's going to lie on us. But as far as allowing or not allowing, whatever GADEC wants to do or whatever the people in the parade want to do.
So would it be fair to characterize the council's position as is that you're not going to withhold issuing the permit, but that you would advise against?
I think it would really be good for GADAC as the sponsor to go to some of the folks that have been in the parade, particularly the it's the bands, the high school bands that bring people out to the parade because people come to see their kids in the parade. And if the school districts aren't going to allow participation, then that might be the answer to their concerns.
And that
Right
was
there.
a situation at the Veterans Parade. I
So-
believe 2 or 3 of the school bands did not participate because they had either positive numbers or enough in quarantine that they felt the right thing for them to do was not participate. But I agree with what Councilman Kelly's saying. Ideally, that probably is the best way to go about it. But yeah, let them go get the advice and decide.
Okay, so as I understand the council's position is that GADEC should make the decision about the parade.
Yeah, and I think that they should look to try to put in some measures to try to maintain any type of social distancing that they possibly can. And if that means, maybe that's a decision, again, they need to make about their event.
Yeah.
Okay. So next, on a non-COVID-19 related issue, the 39th Street project is wrapping up. The council passed an ordinance earlier this year, and honestly, it went through some iterations at the end, but I think the agreement in broad principle was there are 3 developed homes and some undeveloped properties in the area. So I think the idea is that there was going to be some kind of cost sharing, but that's not really reflected in the ordinance. Fortunately, the price on the overall project came in lower than we expected, so it's less than the $14,000 and change specified in the ordinance, but that's on sort of like the per lot basis. So my suggestion or recommendation would be to work with the solicitor and have the property owners who have developed properties who need to connect sign some kind of payment agreement that allows them to pay that sum over some kind of longer period of time as part of their tax bill, and then not collect it for the undeveloped properties until those properties are actually developed, and have those properties have some kind of a lien or encumbrance or agreement. Because if you don't have a house there, it seems like, that's a lot of money to pay in excess taxes on a undeveloped lot. And still, I know that seems like a lot of money, probably because it is, but it's also less expensive than having a failing septic system and having to, and I guess because of the grades there, they would have had to do like potentially pump and haul. I mean, there weren't a lot of good options there. So I think overall, that's probably the fairest way to do it. But I just wanted to make sure before we approach property owners, because honestly, I got a little, it's been a while, and my notes aren't really clear about what the intent of the council was. So does that sound like kind of how you wanted it to go?
Yeah,
Okay.
I believe so.
The main thing is that each lot, you have to assess it equally. From the standpoint of you want to wait till someone develops it and taps in, fine, but the amount's got to be equally distributed among those lots. And yeah, we can draw up an agreement for people to sign, and quite frankly, it's something you'd want to record too.
Yeah.
That way, they can make those payments, but if for some reason they would sell their property in the midst, while they're still in the midst of those payments, then you could have that satisfied as part of any closing.
All right, so I'll work with the solicitor to try to wrap that up, but I've looked at the project. I think it's turning out well, where things are moving along on the stormwater side of it. It'll be good to have that one in the rear view mirror.
This was a good timing for a dry summer there.
Yeah, I mean, it's overall, I think we're in great shape. The 457 retirement savings thing, appreciate your support on getting that signed. We're progressing to finish that. The pension RFP is at least the formal process is over. We have our final recommendation of a selected vendor. So we'll be meeting with the 2 pension boards, police and non-uniform, fire and non-uniform. There's a different composition with the police pension board where the mayor and council still have direct control of the fund, which is part of the law that I'm not sure people have been paying particularly close attention to, but we just want to make sure as we're updating everything that the solicitor's been incredible, props to Tom. The turnaround on legal stuff has been really quick, so that makes my job a lot easier. So we've already got the contracts back on the pension investment management services, so we're zipping along on that. Hearing positive comments on Heritage Plaza, which is nice to hear from citizens. I'm going to a meeting at the Chamber on the 3rd, which I understand Councilman Carper and Councilman Nickus have attended previously. So talk to them. Apparently they have a policy group. I had some questions from council about the fish in Lakemont. So, you know, it's not a city issue. County owns the property. So there's no municipal involvement at this point. So that's it's not us. Zoning hearing appeals, our zoning hearing board. Do you want to receive anything? Because we've been sending packages for things like fence variances. It doesn't make sense to me that they're going to council, and we need to overhaul our land use procedures anyway. So if you want to see them, we certainly don't have a problem sending them to you, but I'm always concerned about just shooting things into your email boxes that are not relevant or meaningful.
I don't mind receiving them.
Okay.
Yeah, I don't mind it. It's nice to be able to just take a quick look and
Mhm.
here's what it is.
Yeah.
Because in case we get a call or something, because that does happen once in a while where somebody attends the meeting and then we'll call one of us and say, hey, they ruled this way, why,
Yeah.
or something.
I mean, it would be nice to get that same sort of agenda treatment for the planning commission as well, for what they have
The
going
goal,
on their meetings.
Yeah, the goal is to make, have a more systemic approach to how we do land use processing with both the planning commission and the zoning hearing board.
Yeah.
And to have a simple form, a procedure that is uniform for both bodies, although they are somewhat different, and I'll be talking to both groups about that, because technically the zoning hearing board exists to hear appeals from decisions made by either the zoning administrator or the planning commission. So one is sort of an appellate body, the other one is more of a policy-making land use approval body. But just things like on the application, so when someone asks for a fence, you know what they're asking for in kind of simple terms to try to just make it more efficient for you to say, oh, okay, I get it. This is what they want to do with that. And part of next year, what I hope we have a chance to do is dig in on land use issues in terms of simplifying regulations, not requiring things like permits for fences, trying to simplify things to the extent possible, and try to make it easier for people to do redevelopment in the city, which thematically is something when we started the year, we heard you want to encourage businesses and property owners to redevelop in the city. What we want to do is try to streamline that process to the extent possible. And part of the goal, because I know one of the things that the chamber wants to talk about is planning and land use, to explain to the development and community, we want you to come in. We want it to be a one-stop shop. We want you to have a checklist. We want to make it simple, straightforward, and easy to get through. That's just going to require us to change a few things. So we'll be working on that. I sent out some branding information. I think I've had one member of the council give feedback on the logo ideas. That's something that we can workshop at some point. If you think we're way off the mark, that would be good to know, so we can revisit it. If you think that there's some ideas there with some potential, I'd love to get something. I'd love to get something better than what we have on the books and be able to start that process, because there's a lot of things that we can do, and we are going to be doing an overhaul of the website in the coming year. We're going to try to be more aggressive with social media. We're going to be pushing up more content on the local access or the government access channel. The branding issue is something really, I think, important to that in terms of fitting into that overall picture. So
I have to confess, I did not give you any feedback, but I could not open the attachment.
okay,
So,
okay.
you know, there
we'll
are
put it in
certain
a
things
PDF
I
and
get sometimes that I have trouble opening. And so, If it could be attached even as like a
We'll-
JPEG or something, that
Yeah,
would be
yeah,
helpful,
and
so.
we'll print it out and we'll make sure that we'll do everything we can to make sure you can see kind of what the Jonathan and the graphic artists have come up with so far. I mean, Councilman Ickes weighed in on his, and when we need to do a better job of identifying which logo is which too, because we didn't actually put, we'll come up with some kind of code. FEMA wants to know if we really own our fire department. So if anybody has a receipt from when we bought our fire department, in a shoebox or something, Chief Heilman's applied for reimbursement from FEMA. This is our third round of at this point, we've done actually more work providing FEMA with information than we're asking for reimbursement for. So this is, this is purely an editorial comment. It's in the midst of the pandemic. And the other thing I'll mention along with this is that I've checked with AMED and with CBRC. Neither one of those entities have heard the status of their CARES funding application yet, let alone receive the money. So at a time, and I really appreciate the leadership of the mayor and council by saying, hey, there are entities out there that have been far more hurt than we have by this pandemic. All that money doesn't do anyone any good if it's sitting in a county bank account and not on the street with the entities that are getting hit by this. And I still continue to have concerns about the impact to AMED and to CBRC and other entities in the community. So
That's especially alarming with AMED. I mean, what happens if ambulances stop running in the streets?
we're in serious shape because that could potentially impact the fire department, because we can run BLS and we do have responsibilities, but I don't know how you'd like to follow up on that, but certainly I think it's important that we keep the issue out there, because these entities are really, they're hurting for cash.
Is the county, have they delegated all of the responsibility to the consulting group that is handling their administering the CARES Act application and all that stuff?
I really don't know. They haven't been communicating with us on this. And in fairness, we haven't applied for any of that money, but
Right.
but I've also heard from AMED and CBRC that they haven't been communicating with them as grant applicants either.
Yeah, they need to like step up and go Cuba Gooding Jr. and say, "Show me the money," if they want to see it. I mean, it's really that simple.
So
There's your obscure movie reference for
Yes.
the evening. But I think Ken, I mean, I'll speak for myself. I don't know if the rest of council wants to say anything, but I think that it would be good for you to send a letter on behalf of council to
Okay.
the commissioners, inquiring about the status and reminding them of the significant need for AMED and for the rec commission.
Yeah, I agree with that.
Do
It's a great idea.
we have consensus on that?
Absolutely.
Yeah.
Okay, then I mean, I would.
I know they look forward to my letters.
I'm sure
I was
they
thinking
do,
that,
but
yeah.
I just think we need to maybe remind them of the significance and the role that these groups play in our community, the financial problems that they've experienced and have to deal with, and that they have not heard anything. So I think it's fair to ask for a status update.
Will do.
Yeah.
We'll let her go out tomorrow.
Yeah, because
Thanks.
it's not even like a situation like we made the decision way back when, like,
Not to
we
go
don't
after
even
it.
want the money. Let's
Yeah.
just pick who who needs it the most, because it would be so obvious to give it to who needs it the most, and that's who needs it the most. And if the county has it, they should be passing that along for sure.
Well, and speaking to Gary at AMED and Mike at CBRC, I know that there's a profound appreciation for the city's willingness to say, hey, we recognize how you guys have been impacted, and they really appreciate it. So, and I'm sure even more if they actually get the money. That's it. Can I answer any questions for council?
Thank you.
Thank you.
All right, moving on to this council discussion items. Councilman Ickes?
None at this time, Mayor.
Councilman Councilman Buttermilk?
Okay. We did get some really good feedback. We ended up moving trick or treat, and we always forget about this. We always go through the if it rains and then at the last minute trying to make a decision. Perhaps maybe we should consider moving that to the last Saturday in October. They really seem to like that. Last Saturday in October from 1 to 3, and make Sunday the rain date from 1 to 3. And that way it's there, and then it's easy, and we're not scrambling to make a decision at the last minute when the floods come.
I think that's a good idea, but what if we pick the day on the calendar that says Halloween?
That's fine too. Doesn't matter to me.
And all the questions and concerns are out the door, and the government's not involved in trick or treat.
I would be okay with that. I would say one thing that 1 to 3 I thought worked great. I heard some feedback that was negative about the 1 to 3. I was wondering if anybody else had heard anything.
Just to kind of reiterate Councilman Ickes' point, I'm all in favor of the 31st actually having it on actual Halloween. That being said, I also got a lot of good feedback from people Saturday whenever I was taking Angelo out trick-or-treating. And so it was all positive stuff that I heard. And of course, having a 70-degree day in October helps out as well too, you know. But it was all good feedback that I got, and it was actually kind of fun being out there in the afternoon, even though it wasn't dark out. But it was pretty fun. I enjoyed it.
Can we prepare a resolution for the next council meeting?
Or it can wait. I mean, there's no rush. It's just, it happens every year. If something like that happens, then we completely forget about it. And I was just thinking,
Well,
well,
we don't completely forget
Well-
about it. It's just something we don't like to discuss.
Yeah, we
Because I mean, let's be honest.
see,
mean,
it doesn't matter to me if we like to or not,
when-
because people are crying to us to make the decision. So,
when we have it on other, when every municipality in Blair County has a free-for-all as to when it is, you get a lot of, the dynamics are different.
We start getting,
A lot of folks coming in from other communities, and so it's like I said, it's not something we forget. It's something that we probably just don't want to
yeah.
deal with. So, but I just think that what we can't be doing is we need to have a game plan and not be changing everything at the last minute.
Yeah.
I think that's the number one thing. If we're going to have a date and you want to establish a weather date, that's fine. But I think we need to do that in advance. That way you can pull the trigger on it without having to be running around. So.
Yeah, I think having a weather date though, a weather rain date definitely is something to do, because that's something that we run into now, 2 trick-or-treats in a row of weather. So
December's always a good time to set the calendar for the coming year.
Yeah.
we get a lot of people calling in, starting in December, and a lot more in January. A lot of people that have to create their schedules at work a year in advance. There are some people that have to do that. Hospital is one of them. So people want to know what the date is, because they need to I guess, ask off and put that as their date to take their kids or whatever. So that's why I was asking if we could do it and then add it to our calendar when we're adding everything else to the calendar in December and January. If you think you would be ready at the next council meeting to do that.
maybe we hold off on that one.
Okay. I tried.
What's going on in my mind right now? Ideally, give it to, like, if Sheriff ought, and this is the first year I heard about it. I know the sheriff likes to be the guy that gives out the information. Well, if he wants to make the decision on it, let's, for all of the county, that's fine with me. If somebody wants to be a central decision maker, I just think it's good to have a game plan a year ahead. Whatever we decide, let's make the decision now instead of at the last minute when everybody's scrambling to figure out what to do.
we can draft a resolution appointing him as the Great Pumpkin, if you'd like.
Wow.
Yeah, I always thought it was the city that set the date and the rest of the county followed up.
Pretty
Followed the
much,
city is
yeah.
how it's been.
Yeah,
I mean,
that's
just out
fine
of-
too. I
yeah.
mean, there was ambiguity in the who does what and why.
And
I never knew that. until
not
I
to
saw
get
the
too
letter.
sidetracked here, but I feel like
We're past
already,
that.
We're
We've already
already
crossed
there.
the Rubicon, man.
Yeah.
We've already crossed the Rubicon.
What is the reason that we do trick or treat on the last Thursday? Is it because of the Keith Roosevelt game used to be
Yes.
played on the last Thursday?
That's what
of-
I was
of
told by.
No.
October?
That's what I was
No,
told.
you're not old enough because the Keith Roosevelt game, the junior high school football games were always played on Friday afternoons right after school. That was only a more recent,
When my
that
brother
was a more
played, it
recent
was
phenomena
Thursday.
that that's why you younger people. But it was held on a Thursday because oftentimes the 31st of the month follows on a Sunday.
Yeah.
People don't like having it, and in 2021, the 31st is a Sunday. A lot of people don't like having it on a Sunday because of conflict with church. Also, historically, the 31st could have fallen on a Wednesday. Wednesday was always a very big church night as well.
Yeah.
Even maybe less so now with the mainstream denominations, but still a pretty significant. So it was moved to Thursday. And then you also avoided, by doing it Thursday, you avoided high school football games on Friday and Saturday by doing that. So it was just always, as long as I can remember, had always been the last Thursday of the month, because you avoided all of that.
Interesting. Thank you for clearing that up.
Yeah, that's,
So. When the meeting's over, I'm going to Ken's house and get a leftover payday and Zagnut bar. That's where I'm going.
Full size one.
Full-size ones.
Councilman Butterball, do you have anything else?
Oh, by the. Well, yeah, I do. Next year, I think we should make the council schedule. It seems we have a consensus that we really like the council work session schedules on Mondays at 6 p.m. If we start at 6 p.m., we get out of here before whatever time it's going to be tonight. Seems to be very productive, and I thought, why don't we just have both meetings of our month on Mondays at 6 p.m., second Monday and fourth Monday, and if the Monday happens to be a holiday, we can move it to Tuesday for that particular month. But would you guys be willing to look into that, and then that clears up at least people having to remember, hey, is it Wednesday this time or Monday this time, and it gets everybody in the habit of it's all more of a single day.
Yeah.
I'm good with that.
I think that puts me batting at 250.
Falls on a Monday.
Yeah. Yeah, if the 31st of October falls on a Monday, then
we can give out big candy bars here.
there you go. Oh, thankfully, that's all I have.
Okay. Thank you, Councilman Kelly.
What could I possibly add? Been here forever and covered everything. I have nothing more to add, thank you.
Councilman Carper.
Nothing outside the standard, wear your mask, keep your distance, and we're going to get through it. We just have to keep working.
Thank you. Questions from the media, Bill?
Thanks. I really don't mean to be a jerk, but I was wondering if
Wow. Wow, that's a premise to a question.
Dr. Burwell, I talked to him the other day by phone, and he said he was planning to ask community leaders for elected officials in municipalities and school leaders to model good behavior as far as COVID-19 goes. And like I said, I don't mean to be a jerk, but the people in the room that don't have masks right now are the council people, and I know it's easier to see, you know, to understand you're talking. I was wondering if you guys had any thoughts on that, on modeling good, you know, on being good examples, I guess, for the community, given the big spike in coronavirus cases now.
Sure.
I would say, yeah, I have no problems wearing a mask at a council meeting. Now we are, we are 6 feet apart or so, probably a little bit more. So we are doing social distancing here. We do have the hand sanitizer here at every station and out, out there, and we only bring people in as necessary when, we have specific presentation or talks about them. But as far as modeling good behavior for optics reasons, I personally, I wouldn't have any problems wearing a mask. Maybe even when we talk, you could take it down to talking on the microphone if people that are hearing impaired are going to have trouble hearing us. But that would be my own concern is making sure that everybody can understand us clearly.
Yeah, the minute we get up, we put them on.
Correct.
If
Yeah,
we're within
I-
6
correct.
feet of somebody, we put them on.
Correct.
Yeah, I mean,
I wore mine in, I'll wear mine out. When I went to the restroom, I put mine on and wore it when I was passing through. And but thank you for your question.
Yeah, and the mayor, he put his on when he got up and came
We're-
back. And
we're doing our part to adhere to the guidelines, and we're taking COVID-19 seriously.
Okay, any changes to the budget from what was announced before for the tentative
Nope.
budget?
No changes.
Okay. The adoption date is what date?
Next council meeting in December.
Okay.
December 2.
Yeah, that sounds right.
The COVID-19, or the CDBG plan for shifting, funds for the homeless shelter, is that the same as it was before?
Yes.
Okay. And do you have an estimate for the amount that each lot will pay for the 39th Street project?
It's between $13,000 and $14,000. I can get that exact number to you tomorrow. We just reran the numbers based on what the actual expenses were. So I think, if I understand it, the council doesn't want, there's a higher number in the ordinance because that was based on an earlier number. If we didn't spend as much, I'm sure the council doesn't want to pass on a nickel that we don't have to property owners.
Right, and does everybody pay the same, like,
Yes.
no matter what the size of the property?
Yes.
Okay.
I think legally we have to treat all
Right.
these properties as similarly situated.
And so that will apply whenever development occurs on the properties that aren't developed? They
Yes.
pay the same, okay. And then, one more thing, are AMED and CBRC, are they, clearly entitled to the money that the county has to distribute?
I don't know entitled. I think that they applied for the funding based on their needs, but
Eligible would be a better word.
well, I think so. I think they would have determined that in making their application, but really I'm not the right person to talk to when it comes to the county's criteria for awarding those funds.
Okay, thank you, that's all.
Meeting's adjourned.